Thank you very much, Amy, for spending some time with me. I'm thrilled to have very well-respected doctors be a part of this program, and I'm thrilled that you could be a part of it, and I would love for you to give us a background on who you are, what you're doing, anything that you feel is important to be part of this.
Thank you so much. It's really a pleasure to be here, and I am Amy Tiersten. I am a professor of medicine at Mount Sinai School of Medicine. I am a medical oncologist whose focus throughout my career has been in primarily breast medical oncology, but gynecological malignancies as well. I have a clinical practice up at Mount Sinai where I see patients, and I also spend part of my time doing clinical trials and research and new drugs and new approaches to treatment, and also do some teaching. And so I have a great passion for treating women and breast cancer, and would love to share some of the exciting and challenging things that are going on in my field. So,
well, I mean, I think one of the big questions is what is going on in the field now, and what would be interesting for people that's not common knowledge, and what do you see on the horizon?
You know, there really is a revolution going on in all of oncology, and very much exemplified in the field of breast cancer, and that is a better understanding, increasing understanding that it's really the specific biology of the disease that determines prognosis and determines treatment. So breast cancer is actually several different diseases, really. One of the most important aspects of this is that breast cancers have 3 possible receptors on the surface of the cell. The estrogen receptor, the progesterone receptor, and then a protein called HER2/neu. In the world of breast cancer, years ago, we really just thought about it in terms of in a coarse way. The stage was determined by the size of the cancer or the number of involved lymph nodes. But now, prognosis is much more about not an arbitrary cutoff of something as 1.9 or 2.1 centimeters, but what drives the disease, what feeds the cells. And so treatments are much more tailored to the specific types of breast cancer. And that allows us to be more targeted in terms of treatment. So, years ago, we basically had chemotherapy as our weapon. If you think about it, chemotherapy is pretty coarse. You kill cancer cells, but you also kill a lot of normal cells along the way. And when therapies are more targeted to the specific biology of the cancer, we're able to avoid damage to normal cells. So that's been a huge advance in my field. And one very exciting advance over the last number of years is that we understand in hormone-driven breast cancers that sometimes those cancers can be treated with antiestrogen therapy alone, and we can avoid chemotherapy. For so many women who received chemotherapy, we're actually able, by doing genomic profiling of the tumor itself, we have profiles that allow us to predict the patients who are really going to benefit from chemotherapy and avoid chemotherapy in approximately 2/3 of the women that we used to treat. When I was training, if a woman had a cancer bigger than a centimeter, they got chemotherapy. And now one of my favorite parts of my job is to tell a woman that she does not need chemotherapy and can be served by just a targeted treatment to the estrogen receptor, for example.
What is an antiestrogen? What is that?
So there are different ways of treating estrogen-driven cancer. There are certain medications. One is tamoxifen. That's a common drug that's used. That's a drug that actually interacts with the receptor. Interestingly, it blocks the receptor in breast cancer cells so that whatever estrogen is in your body can't get to those cells, and those cells are fed by estrogen. And it actually, so it's an antiestrogen in breast cells, but it actually acts as an estrogen in other parts of the body. So in a postmenopausal woman, it actually helps act as an estrogen on the bone and promotes healthy bone, acts as an estrogen on the heart, and promotes a healthy cholesterol profile. So these are very interesting drugs. They are tremendously important in the treatment of breast cancer. About 2/3 of breast cancers are hormone driven. So tamoxifen, by blocking the receptor, essentially starves the cells of estrogen, and that's what they need to live on. Another very common form of antiestrogen medication is a category of drugs which are known as aromatase inhibitors. Those are different from tamoxifen in that tamoxifen interacts with the receptor but doesn't change the amount of estrogen in a woman's body, whereas the aromatase inhibitors are cutting off production of estrogen. So it starves the cells in a different way. These, estrogen deprivation therapies can have a lot of side effects for women.
Like menopause.
Like menopausal type symptoms. But thankfully, over the last 5 years or so, there has been great attention in clinical trials looking at ways to manage the side effects of these drugs. So for example, hot flashes are a common side effect of some of these medications. There was a recent trial that came out of our big national breast cancer symposium that happens in San Antonio annually, looking at a medication called oxybutynin, which is a drug that originally had been used and is still used to treat urinary incontinence, but it was found that at a baby dose of this drug, it's really effective in treating hot flashes. And so since the data came out in December, I've been using it in a lot of my patients in whom nothing helped hot flashes. And they're really, really helped by this medication.
And the name of it?
That is oxybutynin, and it's used at a much lower dose than it's normally used for urinary incontinence. And that's pretty new data, December 2018.
No.
Yeah.
That's super new.
It's fantastic.
What amazing news.
Yeah.
Now, how do women find out about this?
It's not so widely out there yet. It's out in the breast cancer, very specific breast cancer medical oncology group, but I don't think, for example, gynecologists are familiar with this literature yet. Yeah, it's amazing. And because those can be incredibly unpleasant side effects for people that disturb sleep, that just, some people have terrible hot flashes, I've seen great results.
And it happens, so randomly at any age.
Right.
There's a girl here who's in her late 30s, and she said to me, I don't know why, but I'm always sweating. I can't wear makeup anymore. I'm sweating all the time. And she said, do you think I have, hot flashes? And I said, well, this is so just random because everybody's so different. We never know. But, it would be interesting if she tried this, and if they went away, A
miracle. There are women who are drenched multiple times throughout the night and have to get up and change their...
But even during meetings or in important situations, and it's so bad for self-esteem. And it's just so debilitating emotionally, too, to have to... we can take a lot privately, but in front of other people... It's so much more difficult to deal with, and it's very hard to tell jokes when you're feeling like crap and you're embarrassed. You can't even do self-deprecating humor because it's a dig deep for that one. But that's such great news. That's really wonderful.
And another thing, actually, that's clearly been shown to be helpful with flashes is acupuncture. So there's an increasing body of literature that acupuncture helps with a lot of these antiestrogen side effects. While it's wonderful that we're avoiding chemotherapy in so many women, not to underestimate the effects that these drugs have. I have patients in their 20s and 30s where I'm turning off all estrogen, and it's really difficult for these young women, and I'm very happy that there's attention and effort being put into ways of managing some of these side effects.
Yeah, definitely. So I'm just still so excited about what you said. I just think that that's so wonderful. What else do you think is sort of on the horizon for women? What do you think work is being done on that may not be ready yet, but it's something positive to look forward to?
Yeah, there's a lot to look forward to. There are, again, this revolution in targeted therapy.
Right.
So it's understanding, not in terms of the receptors, because that's sort of a grosser concept, but on a deeper molecular level, understanding what certain pathways lead to abnormal cell growth. And there's thousands of drugs that are very brilliantly developed that are effective therapies that are not chemotherapy, that are targeted to specific molecular pathways. It's now pretty common in women who have advanced breast cancer to do genomic profiling of each woman's cancer and really try to tailor therapy based not just on receptors, but on a deeper level. Cancer is really a series of acquired mutations. And so if you can do genomic sequencing of a patient's tumor, you can get a look at what mutations specifically are aberrant in this cancer, and then pick drugs that may not necessarily even have been tested in breast cancer, but are specifically targeted to a mutation within a tumor and have great efficacy without a lot of side effects. The other exciting thing is, and this is in all of oncology, it's a little newer to breast oncology, but immunotherapy, you may have heard about or read about, is really an exciting thing that's happening, and that is another targeted therapy that, unlike chemotherapy, is basically allowing a patient's own immune system to recognize cancer cells as different and fight them with the use of a woman's own immune system, which is absolutely amazing.
Yeah.
I mean, cancer cells are very evil and smart, and they are able to put out signals that fool your immune system into being able to find them and recognize them as other. And so they sort of, they put what's referred to as a checkpoint on your immune system, and the new category of medications are called checkpoint inhibitors because they're actually antibodies to the checkpoint, unleash a woman's immune system, and specifically in a type of breast cancer called triple-negative breast cancer, which is a cancer that doesn't have any of those three receptors that we talked about, the estrogen, progesterone receptor, and the HER2/neu receptor. For triple-negative breast cancer that is advanced, meaning it has spread to another part of the body, a recent clinical trial that came out in the fall showed that combining an immunotherapy drug with chemotherapy significantly increases the tumor shrinkage, the time that tumor shrinkage lasts, and it's really exciting stuff.
Wow. So, in immunotherapy, you reference the fact that the immune system is quite a powerful tool that we have, and my whole reason for getting into this whole concept of healthy lifestyle started in the early 80s when my friends were dying of AIDS, and it was basically because their immune systems were so compromised they couldn't fight anything off. And so the reason for me doing all of this was I needed to help find a solution for me to understand, and so what are all the things that can build a healthy immune system? So having said that, and talking about breast cancer, is there something that you would recommend that women should do to support the immune system for healthy breasts? What are the things you know? Now, this is not the answer I'm expecting from you, but my reference, which is very sort of minimal and not intelligent like yours, mine is more of what to eat. So blueberries and walnuts together are great for breast health. So that's the kind of thing that I think about in my diet, or telling other women, I've done research on this and it tastes great. Why don't you just put it in your diet? So is there any tips, woman?
There have been trials looking at food and looking at exercise. Probably the most impressive trials have been looking at exercise. And exercise, and I don't know if this is mediated through the immune system, but it certainly might be. There are trials that show that in women who have had breast cancer, that regular exercise, and it doesn't have to be crazy Peloton, it could be something as minimal as walking for 30 minutes, 5 days a week, dramatically reduces the risk of the breast cancer from coming back. In some studies, like a 30% risk reduction, as much as you see with some chemotherapy regimen. So exercise is clearly, and maintaining a healthy weight is clearly, whether it's mediated by the immune system or not, is clearly one of the best thing a person can do and empower themselves to help fight breast cancer and to fight the breast cancer from coming back once it's happened.
And so would that be preventative also? Do you think it has a preventative aspect to it?
There's definitely data around maintaining a healthy weight and preventing breast cancer. And that might be through exercise partially, but the more powerful trials that have been out there that I've looked at have looked more at reducing the risk of a breast cancer from coming back in someone who's actually had a diagnosis of breast cancer.
That in itself tells you that it can't hurt.
Oh, it definitely can hurt. And obesity in different age groups has clearly been shown to increase the risk of developing breast cancer. So you can infer that.
But that's an important conversation, and it's sort of a recurring one that I think is important that women think about, that we're not talking about anorexia, we're not talking about being skinny to be gorgeous, because that's not beauty, but being healthy is really the ultimate beauty, and we want to accept all different body types as beautiful, but not if it's bordering on the not healthy. And I think that it's important to have doctors say this, and Julia said this earlier, and I'm very grateful for it, because it's almost politically incorrect now to say that a big volume, thicker body is beautiful and we should accept it. And I feel like if that body is going to kill you, we have to assist in preventing anything happening, and that means maintaining a healthy weight and doing activities. And I have to say, whenever I work out, when I work my upper body, I tell myself when I'm doing push-ups that are just like, I get to a certain number with the push-ups, the third round of 20, and I'm like, oh my God, I think your breasts, this is good for your breasts. It'll make them stand up and it'll be healthy. Smiling, happy breasts.
It's amazing that you're able to do 3 sets of 20 push-ups.
Trust me, it's a sweat. It's a real sweat.
The other thing just that you asked about in terms of diet, there's been lots of different studies that have looked at diet. And again, more in my realm of women who have had breast cancer, there has been a large trial that showed that a moderately low-fat diet decreases the risk of recurrence. So more than cutting carbs or cutting sugar, which are also good things to think about, what really has been proven in a very large clinical trial in the breast cancer world is moderating fat. Moderately low fat. So that doesn't mean, I hate to see people deprive themselves of, everything is fine in moderation once in a while, and some people get very obsessive about it and really don't allow themselves to enjoy a variety of things. But in general, obvious things like more chicken and fish than red meat, lots of fruits and vegetables, I think is a breast cancer healthy way of eating. So.
Yeah, and I think that there are different types of fats. Like I consume enormous amounts of olive oil.
Yeah.
And because I don't eat meat, and I'm trying to get fats into my system because for my skin, and just I want to be oiled. I want to be greased up, and
you look amazing.
But I do think that there are fats that you can consume, and then there are fats that just like, what's the point? It's not gonna be good.
Like red meat and butter and cream and those things.
Yeah, ice cream.
Yeah.
Stop. So I don't have those, but I love olive oil, and I make sure I have it every day, and it just works, and I think it's super helpful as you get older too. But one of the things that I haven't talked about today, that I think you're a good person to talk to about this, is so breast health is important. We want to know, we want to make sure we're taking care of ourselves and we're visiting the doctor, doing everything, eating properly. But our, self-image and self-esteem is so based on our feminine. From the time we're little girls, we're told how pretty we are, or isn't she pretty, or she's gonna be so pretty, or pretty,
Yeah.
pretty. And unfortunately, it's embedded. There's a little gene that's not going anywhere, no matter how evolved we get. It's still about pretty. So now you're faced with breast cancer, and the conversation maybe of reconstructive surgery and all that's involved with that conversation. So to me, there are two phases of it. One is you find out that you have a challenge and that you have to get through it, and that's an awesome task. And then there's the recovery, the repair, the restoration, which is another phase of it. People sort of put it all together, but it really is two separate, huge events.
You're absolutely right about that. Yeah.
So the reconstructive part of it, the restorative part of it, what do we need to know about that? What is happening with that, and what are the best practices?
Well, obviously the findings of, in the 1980s, that just removing the lump in combination with radiation therapy is equivalent to mastectomy for many patients in terms of long-term outcomes. So there's many women are able to save their breasts and not undergo mastectomy. So that's a wonderful thing, and very happy that that's been studied and is now a standard of care. In women who do have mastectomies, there's a range of different kind of reconstructive procedures, including what's sometimes done is tissue expanders are placed at the time of mastectomy, and then they can be expanded by injecting material into the expander and then ultimately replacing those expanders with an implant. And there's also procedures that are done where a woman's own body fat, say from the stomach, creates breast tissue. These are big surgeries, and these can be really uncomfortable things. And I think that there is also more women that I'm seeing. There's a greater acceptance. Some people just opting not to do any form of reconstruction and feeling good, comfortable with that, I think is also. I think we're seeing more of that. Mm-hmm. I feel like some women feel that they didn't know going into reconstructive really how much it would entail, and that they might have made different choices if they were educated better about it.
Yeah. And and the reconstruction takes time, and it's like sort of a series
multiple
of things.
stages of surgeries. Yeah.
So yeah, it's
a big deal.
In itself is just I think a big decision to make that most women don't really know that much. They think, okay, So
there's so much about. I'm sorry to interrupt. There's so much about the physical and femininity. There's so much about it in terms of the patients I see and the conversation around hair loss and loss of breasts, and in some cases women have their ovaries removed and then the antiestrogen medication. It's really, I think, a huge challenge in my field to address those issues and have people's quality of life, in addition to their quantity of life, be as wonderful as it can possibly be. And the other thing is that we now have the cold cap. Have you heard of this?
No,
this is
what is
basically a very cold cap that's placed on the scalp during chemotherapy. It kind of constricts the blood vessels so that the chemo doesn't get to the scalp. And it's pretty effective in preventing hair loss, so it's fantastic that we can offer that to women now. We do offer that where I work at Mount Sinai, and that's just been a huge advance. It works, it's probably around, I'd say 70% of people keep enough hair that they don't need a wig, and it's, you know, another major advance that has been studied that I think is super important.
And that's put on when they're going through the
the infusion, right? So it's at the infusion center during and after the infusion. So
interesting.
Yeah.
And so it's quite a process. What's the usual sort of, and I'm sure it's individual, but you just found out and now you're past it. What's that usual period of time? Is there a typical?
So I guess we're talking about early stage breast cancer then, because more advanced breast cancer is chronic and there isn't really an end to it. But early stage breast cancer can look lots of different ways. So it can, generally either a lump is felt or an abnormality is found on imaging. A biopsy is performed, a core biopsy, to determine is this breast cancer and what subtype of breast cancer it is. Based on the subtype of breast cancer, sometimes therapy is given before surgery actually to shrink the cancer down. That's commonly done in triple negative breast cancer, which don't have the 3 receptors, and in hormone receptor negative cancers that express the HER2 protein. And the purpose of that is shrinking the cancer down before surgery to make the surgery sometimes more limited. We can take someone who was not a candidate for a lumpectomy and would have to have had a mastectomy, but if we're able to shrink the cancer down beforehand, we can turn people into lumpectomy candidates. In addition, it's a way of seeing right in front of your eyes if the treatment's working. Whereas if someone has surgery first and then you're giving the treatment after, you're doing it based on trials that have shown efficacy, but you're not actually seeing in an individual person an in vivo assessment of how well the treatment is working. So generally, breast cancer is treated with 3 different specialists. There's this breast surgeon, there's the breast medical oncologist, there's a radiation oncologist who's sometimes involved. It's a really multidisciplinary discussion. With more advanced breast cancers or in patients who have worrisome symptoms, usually body scans are done to make sure that the cancer hasn't spread to any other part of the body. And treatment looks very different, whether chemotherapy is part of the picture or whether it's antiestrogen therapy. Chemotherapy, if that's indicated in a specific situation, lasts anywhere from 4 to 6 months usually, and that can be, as I said, before or after surgery, and that's about managing the side effects. Again, chemotherapy is such a terrifying word for women that I really try to emphasize that it literally means thousands of different types of medications and what specifically you're looking at with these medications, and spending a lot of time educating people and minimizing side effects. So we really try to keep a person's life as normal as possible. A lot of people are able to work. We have immune booster shots that we use. We have the cold cap. There's also been a revolution in anti-nausea medication such that most women undergoing chemotherapy for breast cancer really don't have nausea anymore. So it's not just that treatment is more targeted, is that we have much better supportive care. So what I do now is compared to when I was in training, it changes every year,
That's great.
And so then sometimes radiation therapy is part of the picture. That usually is somewhere between a 3 to 6 week period after surgery.
Can you explain the difference between radiation and what it does to chemotherapy treatment? And
Absolutely.
What that does?
So radiation is a local therapy. It's sort of like, consider it like surgery. It's treating a specific area. And in breast cancer, for example, if someone has the lump removed, which is called a lumpectomy, they have radiation afterward to decrease the risk that the cancer would come back in that breast. It's a local therapy. It's a beam that's pointed to a specific area. Chemotherapy and antiestrogen therapy are what we call systemic therapies, and so they travel throughout the whole body, and they not only help with the breast itself, but they kill any cancer cells that might be lurking anywhere in the body, and so they're very important in terms of reducing the risk of a systemic recurrence or a distant metastasis. And so they really play very different roles. If a patient's breast cancer is hormonally driven, and that's about 2/3 of breast cancer, we're usually looking at somewhere between 5 to 10 years of antiestrogen medication, which are
Really?
daily medications. Yeah, there's studies now in certain subgroups of patients that 10 years is better than 5 years, and that's really about, again, managing not just the hot flashes, which I mentioned, but other important side effects such as the aromatase inhibitor antiestrogen medications can cause joint pain. Exercise is important in terms of preventing that. Acupuncture has been shown to be helpful. So it's about asking the patients on those routine follow-up visits during those 5 to 10 years of antiestrogen medication. We see them every 3 to 6 months addressing those issues. So including some of the medications can cause bone loss, so we need to monitor bone density. Again, exercise is very important in preserving bone density. Sometimes we need to give bone strengthening agents if we're giving an antiestrogen medication that's harming the bone. So it's about monitoring bone density, libido, sexual side effects, vaginal dryness, attending to those issues as well, which are really, unfortunate and common side effects of these women. And again, some of these are very young women. The other important part, which I think is interesting, is that as the issue of childbearing in the setting of breast cancer. And that's...
Can I just...
Oh, sure.
1 second interruption. So I just want to, before you go into childbearing, which is really important, let's talk about the age percentages of breast cancer. So if we're talking about childbearing, we're talking about young women.
Yeah.
And so what percentage are in their 20s, 30s? So like how do you...
A very small percentage are in their 20s and 30s. And those patients who have genetic predispositions to developing breast cancer, which Julia probably spoke to you about it this morning, they tend to present at earlier ages, but that's a small proportion of patients. Breast cancer is a disease of increasing age generally. I think that at major academic medical centers, we see more young women because they're coming for trials or they're coming for a breast specialist, more specialized care. But I'd say the majority of women that we see are in their 50s, 60s, but we see, there's an increasing number of younger patients, and we don't know fully what that's due to, whether it's delayed childbearing definitely is a risk factor for developing breast cancer, and other...
Delayed meaning later in life?
Having a child after the age of 30, which is crazy, actually increases the risk of developing breast cancer, where childbearing under the age of 30 decreases the risk of developing breast cancer.
Explain, that's crazy. So tell me about that.
I don't know that we specifically know the real absolute reason for that. It's been an epidemiologic observation. One would think that the way an older, and not that 30 is older in any way, but experiences the large amount of hormones that are floating around during pregnancy may be what increases risk.
And so having a child in your 40s or even at 50.
It's a small risk factor, but it is a risk factor.
So I don't have children, and I've always heard that high risk, no children, bigger risk. Why is that?
No children is not a bigger risk than
Oh, it
having
isn't?
children after 30. No, it's
Really?
not. It is for ovarian cancer, but not clearly for breast cancer. So in ovarian cancer, basically anything that interrupts ovulation decreases the risk. So pregnancies at any age are protective. It's very different, and that is because it's thought that during the trauma of ovulation, that the lining can grow back after the trauma of extruding an egg, and that in that repair of the surface, that's when mutations and abnormalities can develop. So anything that interrupts ovulation, so any childbearing, oral contraceptives have been shown to be protective for ovarian cancer because women don't ovulate if they're taking oral contraceptives. So a kind of different set
So,
of issues.
so I've had some revelations today about oral contraceptives, and that the negative concept of them is really sort of washing away, and we're
Yes.
learning more about the extended use, and it's quite incredible to see how much has changed. And you're talking to someone who used the copper coil as contraceptive in my early days.
Yes.
So tell me about abortion and breast cancer, or any, like if you're pregnant, you abort, it wouldn't necessarily relate, or...
I don't think there's clear data that
Yeah.
increases the risk of developing
Or
breast
not
cancer.
that it increases, but maybe, by... I had in my head somewhere that by getting pregnant, you sort of create more positive but I guess you have to take it through the full term.
Yeah.
Wow, you have like a ton of information. My head is spinning. So, as far as these incredible changes that are happening and the research, where is, like, in the 70s, I remember, we are going to end cancer. We're going to end cancer in this time in this world, so the 70s, then in the 80s. We are going to end cancer, 90s, 2000, here we are, 2020, and we still have cancer. Is it that the cancer is evolving and changing, or is it that we still aren't moving as quickly? Will it ever come that cancer doesn't exist?
No, I don't think that's going to happen. But
Okay.
there's huge, huge advantages in curing people and for people living longer, even with advanced cancer. So cancer is a much, much more curable disease, but I don't think that we're ever going to be able to prevent the beginnings of
Really?
accumulations of mutations. And I mean, I think as we understand more and more of what environmental issues may be involved, or that we will maybe be able to decrease incidence, but I don't believe we're going
Yeah.
to be able to eliminate the disease.
So it's basically as much as you can do lifestyle, as much as you can do in getting checkups and
early detection, right?
Checking your gene, whatever.
Profile.
But basically, there's no vaccine. Like, no.
Well, there's the vaccine that helps decrease the risk of cervical
That's
cancer,
true.
because that
That's
really is a viral disease.
Yeah. So if it's viral, you
yes,
can understand
yes,
vaccine.
yes,
but
yes.
but I guess it's just, this has been part of our, when are we going to end cancer? But just in talking to you, so much has happened and is happening that it really is a better understanding of what cancer is about and how you solve the problem or get it right away or have the tools to act very quickly.
It's truly amazing. And even in patients I have a big practice of advanced breast cancer patients or metastatic patients where the breast cancer has spread to bone, lung, liver, and we have such wonderful therapies that used to be a death sentence in a relatively short period of time, and people are living with advanced disease for many years, good quality and quantity of lives. Yeah, so it's really incredibly rewarding to be able to keep people feeling well and living their lives and going to bar mitzvahs and weddings and whatever else, that it's such a rapidly changing field. I can't even impart the exciting aspect of the reason that I love what I do so much is that literally every couple of years there's exciting new drugs that are
from what you've said. And so one of the connections that I have with Julia is the belief that exercise, diet, and sleep are the best tools you have. Having a healthy lifestyle certainly can prevent a lot of issues, but it also can empower you when you do end up having to be challenged.
Absolutely.
And so just the conversation that you've had about exercise and how wonderful that tool is. So I know that if you can start working out as a way to combat it, having a tool says, I'm going to fight this while you work out, and it's something that you're doing to help yourself. And so I told you about my blueberry walnut, which is so delicious, by the way.
What, do you just individually eat, or is there
No,
some
no,
blending?
no.
Or okay.
I just get a cup of blueberries and I grind up the walnuts
and mix it together.
And the crunchy, I can't explain it, but it's a good combo.
I'm gonna try it. I'm a huge blueberry fan
myself.
myself.
Oh well, then it's great. You're gonna love it with the walnuts. But is there anything else from a diet perspective of stay away from fats, excessive fats and fats in the wrong, but
moderating alcohol intake.
So I was actually going, you read my mind, because Julia and I are big proponents of why even drink? Like, what's the point?
Yeah.
If you know it's not good for you, don't do it. I mean, the idea of 1 glass of wine a day sounded really good, and it is, but I just don't think something that gives you a headache and makes you look bad in the morning is good for you.
Yeah, I mean, I agree with you, and I agree with Julia. On the other hand, I'm not suggesting that people drink, but there are cardiovascular benefits, and I think that some people drinking very moderately use it as a way to control stress. Not that that's the best way to control stress, but I think stress reduction can also decrease the risk of a lot of different diseases as well. So, but moderating whatever the person does, stepping back and moderating out, that is what I would.
I think one of the things that we do here at 12:30 every day, we meditate. And it started last New Year's because we have a year-end sort of what's your New Year's resolution meeting.
Nice.
And so a lot of people said they wanted to meditate. And so I have a woman come in here every day at 12:30, and people who want to come up and meditate come up. And I think it's an incredible stress reducer. And I think women hold all of their stress right here, stomach, chest. Another thing is, and I'm curious about your reaction to this, I became very good friends with Horst. He developed Aveda, and he sold Aveda for billions of dollars and decided to do research on how beauty products were affecting women's health. And I used to wear red lipstick and red nail polish every day. It was it's my thing. Well, he showed me, and he couldn't get any of it published. None of the fashion magazines, because the advertisers are all beauty and anyway, he showed me this article, and I not it. No, you see, I'm not wearing nail polish. I'm not wearing lipstick. And it chilled me right out on even thinking about it. But he also talked about the amount of lipstick we consume in a year. Each woman consumes pounds of lipstick. And he kept doing this. It goes to your breasts. It goes to your breasts. And I think there's a lot of work needing to be done. Everybody is very clear now. They want clean, organic, natural, but the bottom line is we want safe. I still believe, with all of that desire for products that are safe, I don't think the beauty industry is really looking at everything and taking responsibility for the harm it can do for women. So we know just pesticides and hormones in foods and all of these things are not good for us. But I really do believe, besides the stress that we take into our chests, I do think we need to individually be very careful about what we're putting on our bodies, what we put on our mouths. I literally, as you can see, I'm so anti putting anything on my mouth unless I know it's made from plants or something that is edible and, in another zone. So I've become very consciously aware of that. And obviously, it's something that my new NORMALIFE is going to be dedicated to, giving women opportunities to find choices and stuff, because we want to dress up, we want all of that. But is there any information that you know about some of the products we use?
It makes a lot of sense and it's very interesting, but I haven't seen specific literature really, and maybe it's not being published, but I haven't seen specific literature with regard to.
If you ever do, I would love to see what that is, because I just think makes so much sense. I'm biting my lips all day long doing this, and then I eat, and so I'm swallowing my lipstick if I'm wearing lipstick. So that certainly makes some sort of sense.
Absolutely.
That we need to think about that. And I think that there's more we can do just to look at all the different factors, and stress being obviously one of the big ones, and looking at our immune system and everything we can do to boost our immune system.
Yeah, this isn't clearly been shown to be the mechanism, but I believe that, stress has a big effect on the immune system. So, and, things like exercise, again, back to exercise, I think is a great stress reducer, but also things like massage or things like that, so.
I think massage is critically important. I think stretching, I think breathing, meditation, all of these things are really important. I also think I'm using some of the products that I'm doing to kind of initiate behavior. So some of like a cleanser I have is charcoal and aloe, and you put it on dry skin. So I say, whether it's my product or any other, it doesn't matter, take the time before you go in the shower to massage your entire body. Take that time to create self-love for yourself. Do it in the morning, do it in the evening, a couple of minutes here and there. So simple, it's subliminal, but not only does it help our self-esteem, but giving love to yourself, people then feel they want to give love to you too, and there's a power in that I think is part of this back to my goal of building the immune system. I really believe it, and I think the more we do those things for ourselves, even a manicure but with nail polish that doesn't have toxic stuff. So you can go buy some really good nail polishes that aren't toxic, you take it with you, have a manicure, pedicure, and then get your head and neck massage while you're doing it. Like that extra thing, it's better than buying a dress. It's better, and
Definitely.
Here I am, a fashion designer saying it's better than buying a dress. But I believe it, because the experience of having that release of stress and tension, and it also then helps you have a good night's sleep. And that restorative sleep, that's taking every cell and just giving it a little hug, and you're restoring and you're ready for the next day. You're washing away that whatever that day was about, and you wake up in the morning and now, okay, give it to me, I'm ready to take you on. And I think it's not complicated, but knowing all that you said, which is heavy stuff, like super heavy. We had a heavy conversation here with some brilliant information, and that the simplicity of some of the things you can do.
I'm a big believer. I don't know if it decreases breast cancer risk of mani-pedi massages and getting a lot of sleep. You just know how it makes your organism feel. It's how you feel when you haven't had enough sleep. compared to, and you know, your body resets with massage.
Yeah.
So.
And from the time you wake up in the morning, you start thinking about your behavior so that when it's time to go to sleep, you have a good night's sleep. The mistake is everybody thinks they put their head on the pillow, okay, done, I'm ready. Not really. You're still wired.
Yeah.
Like there's a process of, are you going to have another cup of coffee? Do you really need that cup of coffee? Because you're not going to sleep tonight. Or you just had a big stressful call. You know what? Go into the bathroom, shut off the light, put the lid down and meditate. Take a couple of minutes. Nobody's going to know what you're doing in there. And do it. I mean, there's all these little tricks that you can play so that when it's time to go to sleep, you actually restore and sleep. So, Amy, my God, I mean, what you laid on the table today was just exhilarating, exciting, intense. I mean, I'm just overwhelmed by the powerful information, and I thank you so much for sharing. I definitely want to put together some panels so we can do question and answers with people, and
that would be
so
great.
happy that I can introduce you this way so everybody knows your gig and what you do. But it's really so wonderful, and how wonderful of you to pick this as your life plan, your job. I have to say, many times through the years, I would think and say, I'm worried about a 1/4 of an inch on a ham, and people are curing cancer, and here you are, my nemesis that I love you for it. I absolutely do. And so the least I can do is at least make sure I share whatever information so that what you're doing can really be used and informed and celebrated. So thank you so much, Amy.
Thank you so much for having
What
me.
a
It's
pleasure.
so nice to meet you.
Nice to meet you too.